Good afternoon. Today I want to update you about the outcome of the formal review of local restrictions in the Caerphilly Borough and Rhondda Cynon Taf and the developing situation across parts of South Wales. I also want to remind everyone that as the weekend starts, the new Wales-wide measures to help prevent the spread of coronavirus came into force last night. All licensed premises in Wales, that includes pubs, restaurants, rugby clubs, off-licences and supermarkets, must now stop selling alcohol at 10 p.m. All hospitality businesses selling alcohol must provide table service. We have reviewed the local restrictions introduced 2 weeks ago in Caerphilly Borough and also those in Rhondda Cynon Taf. The Caerphilly Borough was the first local authority area to be placed under local restrictions because of a sharp and sudden increase in coronavirus cases. Since they were introduced, we have seen the rate and number of cases fall steadily from the very high levels we saw a fortnight ago. I want to thank everyone living in the area for their help and hard work over the last 2 weeks in adhering to and complying with those local restrictions. There have been very high levels of compliance, and that has made a real difference to the progression of the virus. But we are not out of the woods yet. Although there has been a steady fall in the rate of cases, the level is still much higher than we would want them to be. The restrictions will therefore remain in place for at least the next 7 days. If the rates continue to fall over the coming week, we hope to be able to start relaxing them gradually. The picture is different in Rhondda Cynon Taf. We're seeing cases continue to rise, and that is to be expected. It could take 2 weeks or more to see the peak because of the time between the infection and the onset of symptoms. So restrictions will stay in place, and we will continue to monitor the situation in Rhondda Cynon Taf carefully. A new walk-in testing centre will open today at the University of South Wales Treforest campus. That is part of our agreement with the UK government to create 12 local testing sites across Wales. Tests can be booked through the website or by calling 119. As you can see from the slide, cases are also continuing to rise in Blaenau Gwent and Bridgend, where local restrictions were introduced earlier this week. We have also been carefully monitoring the situation in Carmarthenshire, which is overwhelmingly linked to a rise in cases in Cynhadledd. 8 out of 10 cases in Carmarthenshire are linked to the town of Cynhadledd, and the majority of these have been traced to people socialising without social distancing. We've seen a rapid increase in cases in Swansea. We're investigating these to determine the sources of the increase, but again there appear to be links to close households, contacts and social contacts. The local authority has already undertaken a lot of enforcement work with businesses where breaches have been reported or discovered. As we have seen rising cases in Cardiff and a steady increase in the Vale of Glamorgan, which have been linked to people meeting and mixing in each other's homes, to people socialising without social distancing, and some small clusters in workplaces. We continue to keep a close watch on the situation in North Wales, where the picture is mixed. Cases overall are much lower than we're seeing in South Wales at present, but there is evidence that COVID is increasing in some parts of North Wales. So we will be meeting North Wales local authority leaders next week to discuss the developing situation. We take the protection of people's health very seriously in Wales, and we have carefully considered whether we need to introduce further local restrictions to help control the spread of coronavirus in some of these areas in South Wales. As cases of coronavirus are rising rapidly, we have therefore decided to introduce local restrictions in Llanelli, which will come into force from 6 p.m. tomorrow, Saturday. Local restrictions will also come in place in both Swansea and Cardiff from 6 p.m. on Sunday. That does not mean that people in Swansea and Cardiff should treat this weekend as a big blowout. There are, of course, licensing laws restrictions that are already in place. The measures reflect the seriousness of the position, and we ask people to reflect on it in their own conduct and to avoid unnecessary contact with other people. We will closely monitor the situation in Neath Talbot, the Vale of Glamorgan and Torfaen over the weekend, and we will review whether these areas also need to come under the local restriction regime at the same time as Swansea and Cardiff. The local restrictions mean that when enforced, people living in Llanelli, Cardiff and Swansea will not be able to enter or leave the area without a reasonable excuse. They will not be able to meet indoors with anyone they do not live with for the time being, so extended households, sometimes called bubbles, will be suspended for the time being. All licensed premises, of course, have to stop serving alcohol from 10 p.m. in line with national restrictions, and everyone must work from home wherever possible. Up until now, we have placed whole local authority areas under local restrictions, but in the case of Llanelli, we are acting on a more localised basis for the first time because the transmission of coronavirus is concentrated on the town itself. So we will use the Llanelli ward boundaries to define the limits of restrictions so people know what rules to follow. Bury Port will not be included, and we've done so on the basis of local intelligence and the clear view of the local authority not to include Bury Port. There will be a postcode checker on the website together with details about the restrictions. A large part of the population of South Wales, including our capital city, will be living in areas under local restrictions to protect their health and prevent the further spread of coronavirus. Under a series of rules which apply across Wales to everyone living in Wales, which apply to licensed premises, meeting indoors and wearing face coverings. We know that people can make a real difference in their local area. We're seeing this happen in both Caerphilly and in Newport. I don't want to keep these local restrictions in place for any longer than they are necessary. But with people's help, they may only need to be a short-term measure to help bring the virus back under control. But we need everyone's help to do that, everyone's help to keep Wales safe. Thank you, and I'll now start by taking some questions. We are having some with connection, so it may be that instead of having journalists asking questions from the screen, I may need to read some of those questions out. We've had some come in to us. Can you just check whether we've got Adrian or not? No, I don't think we have. We'll start then with James Williams from BBC Wales and see if we can raise Adrian Masters. So should we start with you, James? No, James is frozen. So we'll start with the questions that James has provided. And the first is, what support is there for businesses in local areas? And at this point in time, we don't have any additional finance or provision. We have had a conversation with the UK government, and indeed there have been correspondence between First Ministers and the Prime Minister exactly on this point. It's not just in Wales, but across the UK, there are a range of restrictions in place that affect different sectors. And the statement yesterday from the Chancellor doesn't set out an additional path for resource or more help for those areas where restrictions are coming into place. It's a discussion we'll continue to have with the UK government because it does require a UK Treasury approach. And I understand when those areas where restrictions are necessary, we would want to be in a position to support those local businesses. But the budget we have here in the Welsh Government is already deployed to help us survive the known threats we already have, which is why, for example, the £800 million that we've allocated into the health and social care system is about COVID survival. It's not about significant improvement. It's not about eating into waiting times. And equally, from the point of view of the Economy Minister, there aren't additional resources available to him to provide a significant package of support for those businesses operating in restricted areas. But I would hope that we'd be in a position sooner rather than later to have a further package from the UK government. That does depend on choices made by the Treasury. James apparently is now available. So James, do you want to ask a follow-up question?
Yeah, the Wi-Fi is dropping in and out. Can you hear me?
I can.
Okay. Yes. A quick one. Why is Llanelli's local restrictions being introduced tomorrow and the restriction to Cardiff and Swansea being reduced on Sunday? Why that? There's been some research published by King's College London that shows that less than a fifth of people who have symptoms have been self-isolating around the UK. Do you have any figures?
We just lost James. I think I heard the two questions. The one about the different timing for the local restriction, the second about whether people are self-isolating, where there's evidence in line with the King's College report, which suggests that about 1 in 5 people are not complying with the restrictions and the self-isolation. So on Swansea, in Llanelli, we have a particular challenge around the town that is well identified as significant in control. We've spoken with the local authority, we've spoken with the local health board, and we understand the need to act as soon as possible in Llanelli. If the same prevalence rates were in Cardiff and Swansea, there'd be much actions. And within the town area, we understand it's about 35,000 people who are going to be covered by the new local restrictions coming into force. In Cardiff and Swansea, there's a balanced judgment about whether to bring them in on Saturday or Sunday. The Sunday will allow people to plan for and prepare for moving out over the weekend. There are likely to be more people across both city and counties who will need to reorder what they're already doing, people already here. It will also allow us time to decide if we need to make a decision that in particular takes account of the links between Neath Talbot and the city and county of Swansea, and indeed the Vale of Glamorgan and Cardiff as well. So the point about needing to make a decision over the weekend for the Vale of Glamorgan, Neath Talbot and indeed Torfaen is really important. And if we're going to do that, it gives us an opportunity to have 2 further days worth of data to make those choices about those 3 other local authority areas. As ever, there is no definite right and wrong choice to make in terms of timing. There's a balanced judgment that ministers are having to make, but we think that strikes the right balance. And again, we'd ask people in Swansea and Cardiff to act now and not wait until Sunday before reconsidering who they're having contact with and why. And the same in every other part of Wales where we can see an increase in cases, and even those that have lower prevalence levels. The way to keep those low prevalence levels out of any form of action is to follow the guidance, to follow the rules, to restrict your contacts, not in particular to have extra additional contact with people in your own homes or in indoor spaces, and to please follow the rules. They're designed to keep you, your friends, your family and your community safe. We've got Adrian Masters on the screen, so I think we'll try to get you before the Wi-Fi drops again.
Yeah, I'm gonna throw in all my questions, Health Minister, in one go, and so they're very simple. The one is with something like 50% of the population under local restrictions. Why not a national restriction? Related to that, with a Cardiff lockdown happening, what happens to Cardiff Airport? And if I can be really cheeky and ask you about universities, should students at Welsh universities remain in place over Christmas, or would they be able to travel home?
I think the position for students, I'll deal with that first, that depends on where we are with disease prevalence, not just in university towns and cities, but in terms of places they would return to. I know that in Scotland they've taken a series of measures, but here we're not at the point where we need to have made that decision in the here and now, but there are obviously matters that are being discussed within each week as we see the pattern shift and change. And one of the things we'll need to do is to understand how the pattern is changing within those university towns and cities once students have been there for a period of time. It's one of the great positives about going to university is you get to have a different experience, often in a different town or city to the one that you have grown up in. At this point in time, that with a large movement of people across the UK, we need to understand what that does in terms of local prevalence. So I don't think now is the time to make a definitive choice about what would happen in the end of year recess, but it's an obvious question for us to consider. In terms of local travel, there's a point about, is there a reasonable excuse to go into Cardiff Airport, which is within the Vale of Glamorgan local authority area? and that depends on whether people have a good reason to travel and where they're coming from. Actually, when you think about the other restrictions we have in place, Adrian, it's been a reasonable excuse to travel through one of the areas, but it's about not stopping off for a different purpose when you're there. And so people are already making choices about travel. We know that lots of people have become very cautious, understandably, about travel and going on an aeroplane, but for people who have flights booked from Cardiff Airport, they just simply need to follow the rules. But there's no particular legal restriction on people going to the airport as long as they're obeying the rules when they do so. And in terms of challenge about a local or a national position, it's one of the choices that ministers will have to consider and make together with intelligence around the country. As I've indicated, we have a different pattern in South Wales compared to North Wales. There are some localised challenges in parts of North Wales. We're seeing a more significant spread around the south. So we have got to consider again whether we can take a local by local area, we need to take a regional approach, or whether we need to take a national approach. So we'll be having meetings with colleagues across the government, but also with local authority leaders through the weekend. And we'll then have to make choices. As ever, because the pattern of coronavirus can change so significantly and so quickly, it is possible that a decision we make on one day may change by the point of the next day or within a few days' time. And that is uncomfortable. It's uncomfortable for decision makers and it's uncomfortable for people as well. But we're living through a really uncertain time. And that's where it's really important that people take control of the action they can take and the choices that they make in the number of contacts they have and in how they go about their daily life. We're seeing compliance with measures in Caerphilly and Newport is making a real difference. And I hope people take on board that message that it's our choices that are the biggest factor and crucially that we can make a difference and that the restrictions are not a simple one-way escalator to further and further action. Okay, I think we've got Adam Hale from the Press Association was due to be next. I don't know if Adam's available. If not, then I'll try.
I'm available if you are, Health Minister.
Excellent, fantastic.
So on Cardiff, I mean, talking about students as well. Students are going to be coming to Cardiff next week for the start of their term. Are you still recommending that they come from wherever they're from in the country into Cardiff, which is going into lockdown? And also the same sort of thing for people who perhaps booked stays in Cardiff or even in Carmarthenshire with Cynhadledd. Are you advising them to carry on their trips as planned?
There are two different things. So for students, they're essentially coming to live in Cardiff. They're coming for education. Now, coming for work or education is a reasonable excuse for travel. And so students will be arriving. Many of them are here already, of course, in their chosen university towns or cities. But the message to students is to be responsible, to familiarise themselves with the local rules, and that's difficult because, again, it's an interruption in the normal university experience where you normally expect people to go out and want to meet lots of other people, and yet now we're asking people to restrict the nature and the level of those contacts. But it's about keeping them safe as well as the towns or cities that they've chosen to come and live and study in. And I am in particular grateful for the very responsible leadership of both our higher education institutions, but also from the National Union of Students in Wales at a national level, and also the student leadership within each of our university institutions. That's really important. There's a consistent and clear message from them. When it comes to travel for holiday, we've been really clear that travel for holiday to stay within a local area isn't a reasonable excuse. That's why we've had difficulty with contact with the insurance industry, with operators, and that's why myself and the Deputy Minister have written to them to ask them to provide refunds and support for people who are no longer able to travel to go on holiday. So holidaying within Wales, if you live in one of those areas, it isn't going to be a reasonable excuse for the sake of argument to leave RCT to go on holiday in Ceredigion, just as if there's a holiday maker from Pembrokeshire who wants to come to go on holiday in Porthcawl, it's not going to be a reasonable excuse to come in to the Bridgend area. And those are all covered on the frequently answered questions that we provide on the Welsh Government website. If people are unsure, then please go and look at the website because it does contain the most commonly answered questions with hopefully useful and informative answers.
Thank you. And we had a joint statement sent out today from the UK, Welsh, Scottish governments and the Northern Ireland Executive, reaffirming a shared commitment to suppressing the virus and to work cooperatively. Is this a sign now that we'll perhaps see the Welsh government's decisions fall more closely in line with those made by the UK government for now, which of course is what those in opposition to you and those in Westminster would like to see?
What we actually need is the four governments to talk with each other to understand the respective position within each of our nations and what the whole UK picture looks like, and to want to have a joined up conversation about the measures we're taking. And if there are differences, as indeed each of the four governments anticipate and accept there could well be to deal with the position we find ourselves in, to understand that and then to help with the joint communication. Where it's possible to agree, then we've shown a willingness to do so. We moved, for example, in terms of having a more consistent position with the measures in England on licensed premises. It's also, though, of course, an area for us to discuss different measures, for example, the support available to businesses, and we look forward to having a continued conversation with measures that can be in place, not just in terms of a broader package across the whole UK, but in particular for those businesses operating in areas of local restriction. I don't think it's as simple as saying that we have to do whatever the UK government decides, or equally that the UK government need to follow the approach that we take here in Wales, though I'm pleased to see that they have followed the approach that we have consistently taken on working from home. But that comes from a joined up conversation, a conversation based on respect and sharing information. It's the best way, I think, to make choices, but we ultimately still have to discharge our responsibilities for the people of Wales. Next on my list is Mike Hughes from LBC.
Thank you very much indeed, Health Minister. We're once again seeing reports of panic buying, and given the fact that with these latest restrictions coming in now, roughly around 1.5 million people in Wales will be under some sort of restrictions. Are people right to stock up, or is the action they're taking immoral?
I don't think I need to comment on the morality of people stocking up, but actually, as we saw during the height of the first wave, the normal supply lines are still there in place and able to provide goods for normal shopping patterns and behaviour. So there isn't a need to go and to buy large additional amounts of items. It's about people still being calm and reflecting the fact that there has always been enough food on the shelves and other items throughout the very height of the first wave. And we're taking action at an earlier point than we did. And that's important because this action is about avoiding the potential to have further harm caused by COVID, or indeed a need for further steps to be taken on a harsher lockdown. But the seriousness is real and it's here, and I'd want people to reflect on the seriousness of the position and to be responsible in their choices. To give you an indication, if we just think about hospitals, Mike, we've seen there are now 108 people with confirmed coronavirus in hospitals across Wales, much lower than when we went into lockdown in March this year. But what that does mean in terms of our shifting pattern is that's 163% higher than a week ago and 300% higher than a fortnight ago. But that's still 90% lower than the peak that we reached in the first wave. Now that, I think, shows the position is serious, it shows it's on the increase, but it shows we're nothing like at the levels of the height of the first wave. So people should take seriously the restrictions that are in place, take seriously the national messages about how to behave to minimise the chance of you or your loved one getting coronavirus, and in that way there'll be more than enough food to feed all of us, and we should get through this without having increased harm take place across the country.
Thank you. And can I very quickly ask you about the app? It was rolled out across Wales and England yesterday. Have you had any feedback, any data come from that around initial take-up from people in Wales? And are you a little bit concerned about its initial failure to launch could hamper efforts for mass take-up?
So my understanding is that across Wales and England there are about 1 million downloads yesterday. I'll expect to have over the coming days more information about what the picture is in Wales specifically. There is, though, I still think a high appetite for take-up of the app, and to be clear, the NHS COVID app is one that is an addition to and a support for contact tracing, not a replacement for it. And it doesn't mean that it can actually avoid the behaviour that we all need to see take place to avoid coronavirus spreading. What it does do, as well as helping you to understand who you've been in contact with, it provides a number of, if you like, behavioural nudges to remind you if you're in an area of higher or medium prevalence. It also allows you to check in to businesses you're going into by having a QR reader function on it. And that means that if you need a diary of where you've been, your phone will provide that to you. It also provides you with a reminder about symptom checks as well. So I think those are really helpful in terms of nudging behaviour in the right direction. Now, the first abortive iteration of the NHS app with the trial on the Isle of Wight told us lots about how it wouldn't work, and that was useful to learn. We now, I think, have a better product that we've been able to endorse here in Wales as a result. We always said that if the app trial was one that was useful and it worked with the system we have here in Wales, then we would want to take part. That's the position we're in, and I really hope people do continue to download the app and make use of it, because it's part of the fight against coronavirus, and I look forward to seeing people behave in exactly the same way they have done in Caerphilly and Newport, and helping to drive down instances of the virus taking place here in Wales. Thank you. Mike, we've now got Will Hayward from Wales Online. Okay, Will isn't able to join us. I think we do have questions in from Will in advance, though, so let's see. No, I can't see Will's questions. We'll try and find. Oh, Will's now back with us.
I can't really hear you very well, Health Minister, but I'll crack on and hope that you can hear me. During the full lockdown previously, the Welsh Government allowed people to still travel for compassionate reasons, a decision which was very much open to that person's interpretation. Does that rule allowing people to travel for compassionate reasons still apply to the areas going into lockdown now?
Yeah, compassionate visits would be part of a reasonable excuse for travel. And we all understand, well, in particular with end-of-life care, the sort of things where real compassion is required. But even if doing that, it's still important that people take proper precautions in the visits that are taking place. For example, if your loved one is in a care home and or a hospital on an end-of-life visit, you need to follow the rules within that institution to protect yourself, the staff, and indeed other people. In so much of what we're doing, Will, we're asking people to follow the rules, and we're trusting people to do the right thing. And it's fair to say that the great majority of people are doing the right thing and following the rules. That's why we are able to see a decline in the case numbers in Caerphilly and indeed in Newport. And we need more people to be like the great majority, because that's the biggest defence against an increase in coronavirus and the harm that comes from it.
Thank you. With Cynhadledd, the first town going into a local lockdown, are there any other towns or more local areas in Wales that are currently a cause for concern? And will you commit to publishing more localised data as they do in England? And if I may just ask you what the current R rate in Wales is as well, that would be much appreciated. Thank you.
Okay, on the current R rate, we'll get more advice from the technical advisory cell as we publish a report each week about what that is, but we're confident it's above 1 because we're seeing coronavirus cases increase. And you'll have seen from this week's publication that we do believe that the rate is above 1 already, and we're taking these measures to suppress that rate, to suppress the spread of the virus. When it comes to other areas, it's rather than running a running commentary on towns or more localised areas where we think there might be an issue, that's why we're having the incident management teams meeting across Wales. That draws together the local authority, the health board and other partners to understand what's taking place within that local authority area. And in particular, the intelligence we get from our high-performing Test, Trace, Protect service is crucial in understanding the local pattern of transmission, whether it's under control, whether there's a clear line of sight of what's being done, and crucially, because there are regular follow-up calls, whether people are adhering to the self-isolation advice. That's what's allowed us to take this decision in Llanelli, not for the whole county area. And it's also that advice that meant that we couldn't take a local decision previously. We discussed seriously the prospect of having an approach that only took in the Rhondda part of Rhondda Cynhadledd. But again, the conversation with local leaders and actors was that there'd be challenges about trying to have a restriction drawn within that particular part of the county borough area, but we also then had increased intelligence from not just testing results, from our Test Trace Protect service, that we were seeing infection rates take place at concerning levels in other parts of RCT. So we took a whole local authority decision there, but we did consider seriously the prospect of a more managed and more targeted and localised set of actions. So it is always part of our consideration, and any further action we take will go through that process, taking seriously the data, the local intelligence, and then making what we think is the right choice to help keep people safe locally, to keep people safe across the country. Thanks, Will. We've now got, let's check, is Mark Hutchings available? There was a suggestion he might be on it. Excellent. I'm delighted to have you with us, Mark.
Good. I'm glad you can see and hear me, hopefully. Can I ask about people who live alone in local lockdown areas? Because not so many weeks ago, they were given something of an emotional lifeline by being able to form extended households, and now that's being taken away from them. Is that not too harsh? Would you consider exemptions in local lockdown areas for people, often the elderly, who are living alone?
Well, the reason we've had to take these measures is because the risk of harm from a significant increase in the spread of coronavirus. And that can affect people in single households if there's community transmission and spread, just as in others. It's one of the hardest, most difficult decisions to take, actually, to take apart the extended household arrangements. But we have good evidence that, unfortunately, those weren't being observed in practice in a range of the areas where we've taken action. That's led to spread within households, but also in some of the socialising patterns as well. So it's a difficult, but unfortunately a necessary choice to make. As we move through phases, then obviously we'll look at the case to alter that if we see an improvement within those local areas. I'd want to give people the opportunity to have contact with friends and loved ones again, not just in individual households, but potentially in other houses as well, where it can be isolating. So that, I hope, underscores the seriousness of what we're doing in a clear-sighted way, and understanding the real impact that will have on people and how they live their lives. But we will, of course, monitor the situation within each locality where measures are in place. And as I say, as we hope to be able to ease restrictions, we'll have to look at how we do that and how we measure and manage that process to make sure we're not simply providing a pressure valve to see a significant rebound back in coronavirus cases.
And with a number of cases going up, what's the latest data on hospital admissions, particularly on the volume and the severity and the age profile of those in hospital with COVID?
Well, I gave some figures earlier about hospital admissions. So 108 people in hospitals with COVID cases. That's a 300% increase on a fortnight ago, 163% increase on a week ago, but 90% lower than the peak. When it comes to critical care, there are 19 people in critical care beds with coronavirus-related symptoms. That's 73% higher than the same day last week, but they are at present low numbers. We're starting to see a trend that increases, and that comes on the back of seeing an increase in the age profile. Now, I don't have exact figures for you at present, but I've seen and observed that in the information we have, not just locally, but also in other European countries where they've been at an earlier stage than us, we've seen the spread of COVID go from relatively fit young adults, but it's moved up the age range. So we do then see people above 40, above 50 and above 60 having COVID in larger numbers, and they're much more likely to suffer more significant harm requiring hospital treatment. So it isn't the case that we can simply say, let's not worry about young adults getting COVID because they're likely to not suffer harm in the same proportion. We know that COVID won't stay within the 18 to 30 group if we don't take measures to control its spread. And that increase, as I say, in the figure and the curve in hospital admissions is something that underpins the choices we're making and, unfortunately, the necessity for them. Okay, we've now got Alan Evans from Cynhadledd Online. Okay, we don't have Alan Evans. We'll move on to Rob Taylor from Wrexham.com.
Good afternoon, Minister. You've talked about the mixed picture in North Wales. Are you able to give detail on that? Is that just closed settings or community transmissions? And are you able to speak about where the areas of concern are?
Well, you'll have seen from the figures that we've published that actually the local authorities giving us more cause for concern than others are in the middle of North Wales, so Conwy and Denbighshire at present. And we are still testing regularly our care homes in North Wales. We're picking up if there are positive cases within the staff cohort. But the good news is there's still a very, very low rate of staff numbers testing positive. It's less than 1% still of all the testing we do. So we're not seeing a takeoff from the community going in with staff into care homes. But our understanding is it's a similar pattern to South Wales where we're seeing increases, and it's primarily driven by personal contact, by people not following the rules on household contact, or indeed if they're going out and seeing people in indoor venues as well. So it's still the same message. Reduce your household contacts, make sure you follow the rules, and make sure that you don't have people who don't need to be in your own home, because that's a bigger risk for you, your friends and your family. And follow the rules if you're going out for a drink or a meal as well. We want businesses to do the right thing, but we need customers to do the right thing as well.
Minister.
So I think we've got a further question from Wrexham before we go to Llanelli.
Thank you.
Thank you. There's a big push to get more people to have the flu vaccine. Can you guarantee that anybody who does want one will get one before the end of the year, and that there are supplies there to match that demand?
We should have adequate supplies to deal with everyone in the normal risk categories, and we've acquired more flu vaccine because we want to actually provide the flu vaccine to people in different age brackets as well. So we're trying to maximise the high-risk groups who are always entitled to an NHS flu vaccine. That's our aim and objective, and we should then be able to take a judgment on whether we can then offer the flu vaccine to people in a wider age category, potentially people over the age of 50. But the starting point is for people with the greatest risk of harm to have the flu vaccine, to have it in much higher proportions than before, because regardless of COVID, there is real harm done every year as a result of the flu. In a normal flu season, 8,000 to 10,000 people across the UK lose their lives as a result of flu. In a bad flu season, we have about 20,000 people across the UK can lose their lives. So the flu vaccine is really important of and for itself. But of course, across the UK, we've already seen more than 40,000 people lose their lives as a result of COVID. So I hope it puts into context in one wave of COVID the sort of harm it's already done and the reason why we're having to take these truly extraordinary measures to intervene in the way people can live their lives. Thank you, Rob. We'll try to go back to Alan Evans from Llanelli.
Minister, with the new boundary by boundary approach, could you clarify how measures would be policed in order to keep people in and out, so to speak? Would people from sort of villages outside be able to travel in, given that Cynhadledd and Swansea and places like this are the hubs for shopping and resources and supplies?
So as with every area where we've introduced local restrictions, there are reasonable excuses to travel. Those reasonable excuses can be for work or for education, or indeed for getting medical treatment or essential food shopping as well. So if the only convenient shopping place for somebody is within or just outside the Llanelli area where local restrictions are coming into place, that's a reasonable excuse for travel. What we have found, though, is that actually people have been very good at following the restrictions on travel. This week, in the technical advisory group report we published, we showed conclusively, I think, from data from mobile phone providers, a significant reduction in journeys and in travel. So it does show that people are following the rules and staying within that local area wherever possible. It's in the interest of people from Cynhadledd to make sure they follow the rules, because the sooner we see compliance, we see a reduction in case numbers, the sooner we can be in a position to lift them. It also matters people outside the Llanelli area as well, because there's a higher risk of acquiring coronavirus if people decide not to follow the restrictions. But we're not going to have a set of traffic blocks all around the town of Llanelli. We're relying on people to take seriously the message and the rationale that underpins the choices that we've had to make to protect public health.
Given that this could last quite some time and the numbers rising, it could go up, And given that we live in a country whereby much of it is a rural landscape, which has been stripped of community resources over the years, will the Welsh Government now be looking at a long-term plan at ways in which communities could be adapted, rebuilt to include corner shops, support for local businesses, post offices, smaller schools, localised bus services, community hospitals, and the return of more district nurses? In fact, going back to Wales that used to have all these things in place.
Well, there's a broader question that goes well beyond coronavirus, of course. And you and I will both be familiar with the fact that many people have changed their shopping and retail habits over the years, from online shopping and retail to people choosing not to shop in a local shop as well. Now, there are challenges about behaviour, but also about how we live our lives. And you'll see in the broad range of government policy, we are looking at trying to have town centres that are vibrant again, so people don't need to make choices to travel a long distance for a range of different things. We're looking at not just having specialist services within the health service, we also have been consistently pushing out services out of hospital into the community. So I know in my own area within the government that we have many more facilities available within a local high street optician. You can get services there that you'd have had to go into hospital for not that long ago. So it isn't a one-way street where everything is taken out of local communities. We are looking to have more services in communities. And we also, of course, want more economic activity spread around the country as well. So Wales won't look like it did 30 years ago in the future, but we are looking to take a deliberate approach to make sure that we don't leave areas behind, and you'll see that in the widespread of government activity. But what coronavirus shows is that in Carmarthenshire we've been able to take a local approach because we don't see spread within the rural areas of Carmarthenshire, within other towns within Carmarthenshire. So it's the first area we've been able to take that local action. And so we'll continue to look at that as we take measures, not just in Carmarthenshire, but in every part of Wales. Thank you, Alan. We've now got... the connection appears to have gone, and I don't think we have any further questions that we've had in to us. But as ever, we'll be coming back to provide a regular update on information, and in particular, if we do make choices over the weekend, you expect to hear directly from the Welsh Government about the choices that we've made. Many thanks for your time, and I'll speak to you soon.